A lot of dentists don't like to do extractions. I have no fear of doing extractions. It's part of dentistry. Of course, my primary goal always is to save a tooth if I can. Of course, there are times when you can't save a tooth. And of course, therefore, we have to remove it. What's so cool about doing extractions is that I'm a laser dentist, and laser dentistry is where it's at. And so whether it's a simple extraction or a surgical extraction, it's no problem. And some pretty complicated surgical extractions, a tooth is broken off at the gum line, this type of thing, which could really result in a lot of trauma to the patient, a lot of discomfort. It just doesn't have to be. And with the laser, we're able to accomplish that procedure quickly for the patient with literally no discomfort. And their post-operative discomfort is minimal, if any. Okay, they do very, very well. At Family Dentistry of Windsor, if you need an extraction, we're there to help you. I will say that the only extractions that we don't do, we usually fur out our impacted third molars. And I feel those are in the realm of a specialist, and I send my patients for that. But once again, regarding extractions or any care, when we evaluate the patient, if we see the care requires the need of a specialist, any care requires the need of a specialist, we will certainly always refer them out. We don't want to bite off more than we can chew. Again, it's always what's in the best interest of the patient. Recovery time for an extraction when it's done with a laser is, again, very, very minimal. One of the major complications of an extraction is what people refer to as a dry socket, which is extremely painful. That rarely, if ever, happens when we do a laser-assisted extraction. And if it does, I can take the pain away from a dry socket within minutes using the laser. So it's no longer this long, drawn-out, painful ordeal for a week or so with getting this socket packed. In addition, because the procedure is done with a laser and we're not setting off all these very extreme inflammatory reactions in the body, people, when they wake up from the anesthesia, really have minimal discomfort. It could be a little bit sore, nothing more than an ibuprofen might be required, but they just don't have any tremendous discomfort, and they heal very, very quickly, extremely quickly. Extractions done with a dental laser, it's just, the statistics show that these people just heal better.